Hey everyone, welcome. Whatever channel you're on, whether you're live or in the replay, you're in the right spot. This is Heart to Heart Navigating Lipedema Together. I'm your co host, Lisa Duerre, and I'm thrilled that you are here. If you could drop into the chat where you're live from, we want to make sure we greet you and say hello because this Heart to Heart is going to be a very special one. And I really just want to highlight for you a couple of things that are on my mind as I bring our guest up. So, one of the things that I get asked a lot, and I'm seeing a lot of times in our social media Facebook groups, how do I talk to my boss about working from home? How do I support myself and manage lipedema? What really matters right now when I'm navigating all that is this disease and being fully present in my life? And some statistics have come out that have gotten my attention. We're going to be talking about that today. How might you advocate for yourself? What do you need to know? What really matters as you think about navigating lipedema? And what can you do to support yourself? So I couldn't be more happier today than to have a special co-host. Dr. Leslyn Keith is here with me today. And Dr. Leslyn Keith, welcome to Heart Navigating Lipedema Together. Here she is.
Hello.
Yay!
Nice to be here with you, Lisa.
I'm so glad you're here, Leslyn, because one of the things that really I think for the community at large is getting insights from someone like you who treats patients, who does the research, who writes the books, who speaks on the topics, who educates the healthcare providers as well as the general public. You being in this conversation with me, I think is going to be really helpful for our audience. So thank you for being here.
Yeah, you bet. And what you want to focus on talking about today, I think is such an important thing to discuss. So thank you for bringing this up.
Oh, you're very welcome. Hey, I think everyone on the planet knows you, but for someone who may not know you, Dr. Leslyn Keith, what's important to presence right now as far as like your insights, expertise, or where you're coming from? Where is your opinions and insights coming from? What's your background and how might we help people see why I'm so excited to have you in this conversation?
Well, I have a doctorate in occupational therapy and with a special focus on lymphatic disorders and obesity and how we can help people live their best life, have the most quality of life. And there are so many things that fit together with Lipedema Project and Lipedema Simplified, because as a certified lipedema therapist treating these conditions for over 20 years, we really need to look at the whole person. And it's very easy as a therapist to get focused on just the body part or, the area that's swollen. And it's so important to look at the whole person and all the many different roles that they serve in their life, all the different roles that are important to them. So as a mother, as a daughter, as a friend, as a employee or worker or owner of a business, what are all the roles that are important to the person, and how can we help them have the highest quality of life that they have, given that they have this chronic condition?
Oh, see, okay, everyone, can you just see why this is so great? I'm so excited to be in this conversation with you. So when we were talking and just prepping earlier, I was talking about, I've been reading a lot of news. And I don't like the news. That's not really like to play, but I do get these updates because I'm a consultant, right, in tech. Mm-hmm. And I help leaders prevent burnout and I help organizations drive culture. So I'm always trying to keep my pulse on what's going on. And lately the articles that have been showing up are about, CEOs wanting everyone back in the office more. So right now, usually like 2 to 3 days a week. And what they're saying in 2025 is they're looking for it to be much higher. And the statistics vary, but the sentiment's the same, which is we can only be productive when we get you all together, and this is how it's going to work better, and we're going back to the old ways. And I know my own lived experience of having the opportunity to be remote. I'm remote right now. My feet are up on a footstool under my desk, right? Mm-hmm. When I'm done, I'm going to go get in my lymphatic pump over my lunch break. I'm going to, dry brush or do my big six or do anything else I need to. I have the food I need to reduce the inflammation in my body all right here. And I'm a mom, a business owner, a speaker, right? And I know that when I travel, I have to really put some thought into how am I going to do that while I'm somewhere else. Mm-hmm. And I know I'm not alone. And so when you're, guiding patients and thinking about the optimal experience for them to treat this chronic disease and to be in their lives, what do you think is important for patients to just remember? And not necessarily feel bad about, but actually shift that to be like, oh, I can be great at work, and here's what I need to do for my body. What are some insights you have, Leslyn?
Well, and I think that in business, as you know, that it's got to be a win for everybody involved, and we got to show to the employers how your particular position that you fill, how that you can actually be more effective if you spend more time remote. So not only is it going to be better for you in managing your own health and quality of life, but it's also going to be good for the employer.
Mm-hmm.
And there's certain positions that you have to be in person. I mean, as a lymphedema therapist, it was very hard during the lockdowns for me to do that remotely.
Yeah, exactly.
And we could, consult and give advice and stuff like that. But most of the job is to physically get your hands on somebody.
Mm-hmm.
But there are many positions that don't require that. And we found out how many jobs can be done remotely when we had the lockdowns and people couldn't leave their homes. So I think that was one of the benefits that came out of that is having more access to healthcare because doctors were meeting with their patients virtually, and so and then also that how you can be more effective, more productive when you're working from home. I think that another big thing for the plus for the employer is that they now have a much wider pool of people that they can recruit for their company because it's not required that that person move and live in their area where the company headquarters are. And so this really opens it up to be much, much better for the employer. And so for the employee, well, it's just as you did a brief introduction there, talking about all the things that help you manage your condition so much better and make it less arduous by doing it at home. I think it really is a win-win. And I'm not so sure that the employers really want to push for going back to the old ways when we're seeing so many benefits to this new way of doing things.
Yeah, I think this is a conversation that's going to be fruitful. And I'm seeing Sherry and Julie here. We've got you both. Thank you for being here. Julie's actually said she's sitting at Duke while, I know what's going on for Julie, right? She's somewhere else and she's remotely dialing in, right? Which is another benefit, like to where you're saying, Leslie, she doesn't have to be somewhere exact. She can be wherever and still be here.
Yes.
And one of the things I want to just highlight, so I pulled up some information for employers because I think this is important to think about, right? It's productivity, performance, engagement, retention, and profitability. These are all things CEOs, leaders, shareholders care about. And the data that's coming back in, especially this article I just read from Forbes, because I was prepping, all of these are higher when you have remote work opportunities, right?
Yes.
Productivity, performance, engagement, retention, profitability. So in the work that I do, it's real interesting where, being in person does have benefits. There are times when coming together makes sense, especially when you're in the middle of a change management initiative or strategic planning. There's no interruptions. You can be together. But I also know you can do that remotely because I've done that for our clients. I know what's possible. And I think the thing that is on my heart today when we talk about this is what can we do to help the women, the 1 in 11 women, and there are men involved too, but we don't have the data on that yet. So I'll just stay in my lane right now with what I know. 1 in 11 who have lipedema and are walking around feeling like they're fat or there's something wrong with their bodies or they don't look normal. And they don't even want to bring up, this chair hurts or, I need a upgrade on my air flight because of the way that I fit in the airline seat, or it really hurts me after, I'm standing all day teaching or nursing, helping people move from that like shame or feeling bad that their body's like failing them to really recognizing that with a couple of small changes, accommodations, partnerships that you can work with your facilities team or your manager, what becomes possible. So I'd love to stay in like what becomes possible because I just traveled a couple of weeks ago. I was in person for a couple of days. And by the time I got home, I took the weekend and I rested. I napped because it took extra energy to make that trek. And it doesn't mean it's not possible. It's just if I had to do that every week, I think that would be extremely hard on me. And so when you
Yeah.
think about it, Leslyn, what are some basic things, even like if people are in the office, how might they better support their bodies while they're navigating lipedema and lymphedema? What are some things to think about?
So, and these are things that sometimes will require your employer to provide some accommodations to help you be the safest and the best that you can be for your body. And you brought up one, it's just the chair that you're using. If it is a sit down job, having a good chair, or maybe even having the ability to do your job in various different positions. So a lot of people are using stand up desks, but then they can lower the desk and sit down for a while. So being able to have that change of position, but making sure you fit into that chair and it puts you in a good posture so that you can be in that chair for maybe at least an hour. And then in an hour, make sure you're changing position. And then, as you were already talking about, down lower, you have something to elevate your feet a little bit, or maybe that you could put one foot up on it, and then after a few minutes, you're putting the other foot on it, and doing these constant, even little movements are going to help a lot of people. It's that static position that over a long period of time that is going to increase your pain, is going to make you stiffer. It's going to, all the various systems are not going to work as well. So we have slow digestion. We have, increased inflammation that causes, downstream a whole bunch of other issues. And so making sure that you are able to, wherever you're doing your work, you're able to have those changes of position throughout your time that you're working.
It's you didn't. I was just thinking about, like, I put both legs up, and now I might alter. And this is how we learn in conversation, right? The other thing I've done is I've put a vibration plate under my desk, and I was like, I'll use that all the time. But when I'm facilitating or live, I'm like, oh yeah, how are you? So I had to think about when. But even I even have a fan at my desk for when I get hot, right? So I think there's
excellent.
There's ways to like figure this out, and I think for me, many times the women that I would talk to about this are like, I don't want to ask for it because, they're just going to like single me out or think there's something wrong, or I don't want to draw attention. And I just really, I learned something from one of my mentors a long time ago. She said, don't ask for permission, ask for support. Don't ask for permission, ask for support. And I just think that when we're talking about navigating lipedema at work, however you show up at work, asking for support is a different mindset than asking for permission. Yes. I'm just super curious of your thoughts on that, Leslyn.
Yeah, I think that's an excellent way of putting it, because again, when you have the support you need from your employer, you're more productive for your employer. When I had my own clinic for lymphedema therapy, my receptionist she was starting to develop a little bit of lower leg swelling. I think probably because she was not moving very much, and she was sitting in her chair for several hours a day. And so I said, well, you know what? We have some sample compression pumps. And can you try these out, Krista, and see what you think? And so we would have, one lower leg pump on her while she's sitting at her desk and answering phones and doing her work. And so she was giving her feedback on a product that we used for our patients in our clinic, but also this was improving her leg health. And so, and using a pump didn't change your voice on the phone like your vibration plate might.
Right? Yeah.
And that was really nice for then when a patient came into the clinic, she could tell them, well, you know what, I've used that pump before, and let me tell you about my experience with it. And so this was good for the business, but it also was helping her with her, managing her and making sure she was staying very healthy. So I think there are, many ways that you can be accommodated and improve your health and well-being that are also going to be good for the company and the employer.
Yeah, I love it so much. So I'm going to read these statistics that we pulled up because I think it's important. So these are the top health benefits of working from home. And this is from the U.S. Career Institute. So top health benefits: less burnout, which we all know I talk about all the time; healthier food choices; reduced anxiety and depression; improved overall mental health; improved sleep; increased exercise; improved overall physical health; and improved personal relationships. And this is from Flex Jobs. So these are the top health benefits. And I see that Sherry commented here about sleep. I'd love to bring that up
Yes.
because we know how
Yes.
much sleep impacts our health and every aspect. So Sherry says, I had to stop working because I couldn't get to work on time because I would sleep through all of my alarms because of not being able to sleep at night. I mean, Sherry, thank you for bringing that forward. This
Mhm.
is real. This is
Yes.
real. And I can imagine if you were able to roll out of bed and perhaps had some flexibility in your schedule, you could have been productive during the day.
Yes.
Um, what do you see as the common what can we talk about sleep here, Leslie? I think my question is formulating as my mouth is moving because we're live. But when I think about the quality of sleep and my overall health, and I think about my journey with lipedema when it flared for me in menopause, I had a really hard time sleeping. And I thought it was all menopause. But I think now, looking back, I think it had to do with pain and inflammation and so much more that I just chalked up because I knew that menopause had sleep disturbances. Anything to share about sleep and just thinking about lipedema and lymphedema and Sherry's comments?
Sure. And for me, all roads lead back to the lymphatic system.
Ah, I
So,
love this. Yep.
and so that is going to, everybody has a lymphatic system. And so we get the best lymphatic health we have. And then we're going to be a more productive person and we're going to have a better quality of life. So sleep affects your health and your health affects your sleep. We know that there's that bidirectional impact that's happening there. So your lymphatics in your brain work the best, do most of their work, the majority of their work during deep sleep. And so when you are not getting adequate sleep, not getting deep sleep, your lymphatics can't clean all the junk out of your brain. So it is well known that people who have Alzheimer's or other dementias, they are the ones that have the most sleep disturbances. So if you have some kind of sleep disturbance or sleep disorder, you're more likely to get dementia. And that's because your lymphatics need to clean out your brain every night. And it needs that deep sleep to do it. Well, we have decreased blood flow to the brain during deep sleep, which gives more space for the lymphatics to do their work. So they've got to clean out all that stuff. Now, if you're still in working full time and you're doing a job that really requires a high level of cognition, you've got to have that sleep. And so I think when Sherry, brought up this idea that she had to stop working, so if she, like you said, had more flexibility so that she can make sure that she was able to get her deep sleep time, she could have done better with her job. And that flexibility would have come from working remotely. So this would have made everything better for Sherry, for her own health, but also would have made it much better for her job, for her employer. So I think that, and then also just having lipedema and lymphedema itself, there's been several studies on this that has shown that impacts your ability to sleep because you have pain and inflammation, stuff like that. It's difficult to get uninterrupted good sleep. So your condition is causing that. And then if you also then have the added stress that I can't do my job as well as I want to, or I'm losing my job, that is going to further, exacerbate the issue. So I really think this whole thing that you're talking about today, Lisa, about accommodating different chronic conditions that we have and still being a really great employee, still being able to run a business, still being able to fulfill the roles that are important to you, I think it can be done. And we have to have people come together to support those things.
I really appreciate Sherry bringing it forward. And I think about Sherry's employer who no longer has her. Right, because I know Sherry. She's amazing, and I can't even imagine the loss that happened and the mental health crisis, if you will. Crisis is my word, not Sherry's word, but what goes on in the thoughts behind the employer and Sherry making these decisions, right? Like that's really hard,
Mm-hmm.
really hard.
Yes.
And what I was thinking about, I think the last thing I want to say on this to kind of put a bow or a cherry on the Sunday. I know now, and I didn't know then, but what I know now is that disabilities, hidden or visible, really are the crux of innovation. when it comes to the workplace and just in society, right? So when people talk about what they need or ask for support, it opens other people's eyes. It sure does mine.
Yes.
And what I know is like even when I was reading a story about like the automatic hand sanitizers, and when you put your hand under, they had only had Caucasian hand testing, so it worked fine for Caucasian hands. But if you had a different color skin, or if you were missing some fingers, it wouldn't work the same. And so until they had diverse insight from other people's experience and everybody tried it, much like the pump example you gave at work, we're better for that. So it's a simple example, but what are we missing when we're not including all voices or bringing in diverse thinking? And so this conversation, I know that somebody's going to listen to it right wherever they're at the right moment and go, oh, I need to think about this differently, because maybe I'm just labeling everybody who looks a certain way as obese. And there might be more going on, and they're not even asking for help because there's such this like bias about obesity in our society.
Right.
Like this is it's really, really important, Leslyn. And Sherry,
And that is another issue that probably would be for another podcast. But the whole idea of anti-fat bias, it's definitely a big issue in healthcare, but also thinking about the workplace. And so if you're someone with lipedema and you're perceived as being it's just obesity, then that bias can really affect your ability to really engage at the office.
For sure. Yeah. Catherine and I, when we tell our own stories, and we were just both like, you too, me too. How did that feel? It's interesting because I think if anyone has met a lipedema patient, this is not a willpower problem.
Right.
Ever. Right. Everyone's tried everything to be okay. Right.
Right.
So I want to say to Sherry and Gavin and Gloria, Julie, thank you all for your comments. We're going to talk about how we can help ourselves now, because Leslyn and I want to share with the audience something that you can do right now for yourself. And that is to support yourself and come to our event. So we have a 3-day virtual event coming up. I'm going to have Leslyn talk about it. I'm going to share my screen and show you all this. But here's what I'm going to say before I even do that. When I first understood I had lipedema, one of the first things I did was go to one of these events. They're called Heart to Hearts. And I walked away inspired, connected to myself. I had clear next steps. I understood more of what was going on in my body, and I didn't feel alone, because up until then, I had felt alone and ashamed and angry that it took until I was 52, I think, when I figured it out. That, this has been going on since puberty, and now I'm figuring it out. But to be in a place where I could feel supported, seen, and learn with others and talk to experts and patients at the same time, it was a game changer for me. And I truly believe that first event set the path for how I looked at things about what's possible versus what can't happen. So I believe in possibility, and I believe in the frame in which we look at that. So Leslyn, I'm going to pull this up, and I just want to take a minute so that people can see that we can, you'll even talk to other people struggling and how to talk about it at work. Like, this is real. So let me share my screen. And then if you could just talk for a minute, Leslyn, about it. I would if we don't, I feel like it's a disservice to the community. We need to talk about this.
Yeah. And I can just say, a segue also from what we were just talking about, being a remote worker, this new way of doing conferences and events that came out of our lockdowns, to do a virtual event, a virtual get together, was also another benefit, another thing that we learned. And so this is our landing page to show you a little bit about the event and why you should come. But we have decided we are never going to do in-person events. We wanted to do it this way because you're talking about people who have a chronic condition that, it's difficult to travel. It's expensive to travel. Being able, we reach so many more people. So many more people are able to attend. We have speakers and experts from around the world. Now they can be there also. So this is, our heart-to-heart events are done virtually. And that we will continue to do it. Just, you can see here is all of our expert speakers that we're going to have. Of course, all of us that are with Lipedema Simplified and Lipedema Project, but then also international speakers as well. People that are involved in our tribe community will be talking about their own experiences and how, even though we're getting together virtually, it is a supportive community. And so that's what we're going to be focusing on this, and really on the whole person and what you can do. If you're a healthcare provider, what you can do for the person who has lipedema or lymphedema. If you are a caregiver, how can you support your loved one who has lipedema or lymphedema? And if you have this condition yourself and you're still fulfilling multiple roles in your life, how can you support yourself? Lisa, you want to talk about like the 3 different days, what the focus of each of those days are?
I'd be happy to. And, I love when you talk, Leslie, because your perspective is just so spot on. And I know, so my husband has been to these. He actually spoke at one about what it was like being the spouse, right? And what that really looked like. And I'm so excited to have my CLT be here. Christy's come before. I invite the whole crew. I'm like, you guys, we need to do this. We are the team. Let's do this together. So on day 1, we call this Initiate, where we're going to really give insight into unveiling your body's blueprint. You're going to learn anatomy and physiology of lipedema and lymphedema. You're going to understand types and stages. You're going to gain insights from medical professionals about how this works in your body. And you're also going to look at the current research and medical findings, because the speakers that we have are on the cutting edge of this, and the partners that we have bring this insight as well as the patients, right? Because the wisdom is inside you. So we're going to initiate the learning on day 1. On day 2, we're going to investigate what your unique body needs. What are solutions for you at the stage you're in, the career you're in, the life that you're living? What is most important for you and your body? And you're going to look at personalized treatment plans, engage with experts and patients. You're going to look holistic. And we're also looking at pros, cons, and considerations of GLP-1s, surgical interventions, and everything in between, because all of this comes into play. And then on day 3, we call it Navigate, where you're going to choose your own adventure. You're going to have your own action plan for your body. You're going to understand what matters most for you in the situation you're in, and you're going to have practical steps to take action. So all from the comfort of your home, by the way. Like, this is what I love so much about this is a very robust experience, and you get to be comfortable. So you don't have all the distractions of pain or being hungry or being, I did something a couple weeks ago from a hotel room. I sat on the bed and put a pillow up and had my laptop on it. It was okay, but boy, if I had been home, it would have been much better. So I just want to say that these 3 days are jam-packed, but it's designed for you. It's not about being talked at, it's being talked with, and for you to choose your own adventure. So did I miss anything on that, Leslie?
Well, I just would like to also point out that our events are not just sit there and listen to presentations. We design them for you to be able to interact with everybody else who's attending and all the speakers and the sponsors and everything as much as you want to. So you will have the opportunity to be in small groups, that we have these discussions, the breakouts that we have small groups. You have the opportunity to post things in the various chats and the Q&As, and you can respond to other people who post things. So you will have that opportunity for interaction. Now, a lot of people, when their first event, I think I just want to sit back and just lurk, as we say. And that is totally fine. Do what is where you are in your space right then. Do what feels most comfortable to you. But you might try doing a little bit of interaction and seeing if that is good for you as well. So as whatever level of engagement that you want. But we do feel like doing these virtually is, at this point in time, it is the most benefit to the greatest number of people by being able to do this virtually and make sure it's not just something you're sitting there and listening to, that you have that level of engagement and interaction that also makes it even a better experience. So I'm so looking forward to it.
Mm. I was thinking too, is when I think about our sponsors and collaborators,
Mhm.
RLD Group, my company, is a sponsor, right? This is not just medical professional sponsorships. This is anyone who's interested in helping you live your best life. We've got partnership with Learn. I mean, we have two amazing speakers coming from Learn. Leslie, do you want to talk about them real quick?
Oh, yeah. So that Dr. Stanley Roxon and also William Rapici are from the Lymphatic Education and Research Network. Of course, they also do all other types of work outside of that but these are experts in what we're trying to learn about and how we're trying to help people to improve their lives. And Dr. Roxon is, well, they both are. They're going to be talking about what's in store for us in the future. Where do we go from here? And it's a very, very hopeful future. So incredible. It's so inspiring whenever we hear them speak. And so we're really, it's so wonderful to have them collaborate with us and to be with us.
Mm. Yeah, I'm super excited to hear from both of them. And I know we've got Waries, Eros, Natural Wellness Boston, RX Sugar, Cindy Beers, the Lipedema Project. There's prizes, right? If you show up and you go, there's leaderboards, there's ways to interact, there's ways to get access to these amazing products and this amazing learning. And I just think that when we look at this overall, and I'll just go back to the number of speakers here. When we look at this, I just don't know where else you can go to get this level of insight, this level of care, and this level of community over 3 days virtually. It is mind-blowing to me. So we just wanted to bring it up because it's September 27th, 28th, 29. It's coming up right around the corner. And I think the other thing to know is that some people are like, well, what if I can't be there all 3 days? Or, oh my gosh, what if I have plans this weekend? Well, that's okay. We do have an opportunity for you to take the registration level where you can get the recordings. I do that every time because I want to remind myself and go learn again. Leslie, anything you want to say about the recordings? Because I mean, do you go back and watch them too? I mean,
Yeah.
we watched them the other day, even prepping for this one, right?
Yes. Yes. And some of the talks are so packed with information that you can't possibly get it on one listen. And so having the replays, even if you were there for it, a lot of times is so helpful to be able to listen to that again. And also remember, because it's remote, some people are, when they're at home, they're on their desktop computer, but I got an appointment. They then put it up on their phone. And so that they can still be listening as they're riding in a bus or driving in their car. They're still able to hear that. But if you actually have to have something else you have to do, then you're going, I'm so sorry. I wanted to be there for this particular part. And so being able to get those replays is really important. But that premium access to the event is so much more than just the replays. We have special exclusive Q&As with speakers. We have different post-event webinars, stuff like that. So the premium access people get a lot of extra perks. So it is, consider getting premium access because you really get even a better experience with the conference.
Yeah, it's so funny. I don't know if you remember this, but my first heart to heart, I was live at home, and then I had to go to manual lymphatic drainage. I had scheduled it before I registered for the conference. So I brought my computer and I opened it up, and I think I even took a picture of myself attending heart to heart while getting MLD. I was brand new, but I just wanted to be like, how might I not miss this? Well, there we go. And then I was like, oh, I should do premium because, I could do MLD anyway. It was wonderful because I got to share it with my MLD therapist, and she was like, who is this group and what's going on? And this is amazing.
Yes.
So I just, Sherry put up a comment. Sherry's registered. She's counting down the days. Me too, definitely. And I just want to say, Leslie, thank you for all that you do to bring this event to life. I know in April we had one and you were the co-chair with Siobhan Huggins. And this one, you're right there in the middle of it all too, doing everything you can as the, director of research, board president of the project. And so much that goes into helping the community at Lipedema Simplified. If anyone here loves Leslie as much as I know the community does, if you want to drop in some appreciation for her, thank you for being here today. thank you for all that you do to help us navigate lipedema and have these heart-to-hearts. I mean, you are a gift to our community, Leslyn, and it's been an honor to talk to you about work-related stuff today too, because that's a passion of mine. So thank you for being on this episode of Heart to Heart Navigating Lipedema Together, and thank you for bringing your heart, as you always do.
Thank you so much, Lisa. It's been wonderful chatting with you, and looking forward to the event. Can't wait to see you there.
Yeah, wonderful. Okay, make it a great day, everyone. Leslyn, they're coming in already. We love Leslyn. It's coming in the chat. Sherry and Julie and Gavin and Marsha was here. Just thank you all for being here live with us and being in the conversation. And if this message enlightened you in some way, or you feel like there's someone in your community who could benefit from it, whether it's your employer, a colleague, a friend, a loved one, please like, share, and let's broadcast this message out there. Thanks, everyone. Make it a great day.
Thanks.
Bye. Anne-Marie, thank you.